You cannot make a diagnosis on just 2 or 3 parameters. Especially for a cardiac arrest, you have to do a blood test. Now, this is the first blood test that's been released on the Minicare Acute, and that's called a troponin I test. Now, what troponin I is, it's actually a cardiac enzyme that the heart gives off when the heart is damaged. So the doctor can then draw that blood, send it to a laboratory. Normally it takes an hour and a half to get that result. So can you imagine if it's yourself or a loved one, you're waiting for an hour and a half to know, is it a cardiac arrest? And we all know how critical time is in a cardiac arrest. All right. So what is very exciting about this, it's very portable. You can walk to an ICU bed, you can take it to the ambulance, you can go to the patient's emergency department. Very, very easy. What happens is that you have a cartridge, insert it into the machine. Very, very easy to do that. And what happens is they prick your finger using a normal lancet, finger prick, and you drop 2 drops of blood into that cartridge, you close it, and the machine analyzes the patient's result, test. And within less than a minute, this machine gives that result. So you can imagine from an hour and a half to less than 3 minutes, you have a life-saving test next to your bed, which is amazing. I mean, and Philips also likes to we focus a lot on patient comfort. And in this way, we're also reducing anxiety for the patient. There isn't that long waiting to hear what's happening, and also for the families and friends around them. What's also very unique about this is that you can use it at home. If, for example, you have cancer and you're on chemotherapy, you're weak, you can't keep going to the hospital for tests and so on. If you have this at home, on a docking station, connected to the internet, very easy, like you do your diabetes test, you do a little cartridge thing, put your blood in, pick your own finger, let it analyze, and the result automatically gets sent to your doctor. The doctor will then look at it and say, fine, your blood test looks good, you don't have to come in today for chemotherapy, or they can see a trend and they say, listen, I'd prefer you to come in for chemotherapy today. So it's really amazing how we can change the whole medical environment. Another example would be if you have a baby that's born premature. And we've all seen those babies look very, very yellow, and we have to test and see what the bilirubin levels are. Normally, again, some of the tests will take very long. Now, if you're sitting next to your baby, you want to know exactly what's going on. Again, with this, all you do is use a different cartridge with the marked bilirubin. Okay, you'd select that, or the nurse would select that. Put it into the machine, prick the baby's finger, and within less than a few minutes, you know exactly what's happening with your baby, and the doctor can treat it.